Okay, good afternoon, everybody. Appreciate you joining us today. I want to thank everybody on the call, and I also want to thank our panelists. Let me begin by a few comments. The attendees can ask questions during this meeting using the icon at the bottom of the screen. So if you have a question, you can type that in and Jimmy will get that. Any unanswered questions that you don't get today, what we will do, we will follow up with those questions at a later date, within a couple of days. Jimmy will do that for us, okay? First, now let me introduce all of our panelists. First, Todd Caliva, CEO at HCA Clear Lake. Stephen Jones, CEO, UTMB Health, Clear Lake Campus. Dan Newman, CEO, Houston Methodist Clear Lake. Kelly Ochoa, VP, Operations, Memorial Hermann Southeast, Memorial Hermann Pearland. And then Dr. Sharma, Chief Medical Officer for UTMB. Now what we're going to do is we're going to let each one of our administrators talk 3 to 5 minutes about specifics within their hospital and share with us exactly what's happening with them. So Todd, if you don't mind, will you kick it off?
Okay, great. Thanks, Bob. Appreciate it. And welcome to everyone. And thank y'all for allowing us a few minutes to shed some light on what we're dealing with at the hospital level. And just want to give a big shout out to everyone out in the community and thank y'all for all of your support for all of our healthcare heroes who are on the front line. So here at Clear Lake, we're part of HCA, and HCA has 13 hospitals here in town. So we had a cohorting strategy where we moved all of our COVID patients to 3 individual hospitals in the 3 parts of the city. So we referred to them as hero hospitals. Our hero hospital up north is Tomball Regional. Our hero hospital in the city, the center of the city, is West Houston Medical Center. And then our hero hospital down south is Mainland Medical Center. And that's where we take our COVID positive patients and we move them down to these 3 hospitals where we have dedicated staff who have gone through an immense amount of training and completely understand the importance of their PPE usage and proper usage. And I think our strategy has gone very well. I think we also had a leveling strategy of from a level 1 to how we began, of letting all visitors come in to a level 2 to a level 3, which we currently stood at level 3 as of Monday, and we downgraded our leveling to level 2. Level 2 opened up 2 additional entrances for us at Clear Lake because we started doing elective cases. And that's our 2 main entrances in the Heart Tower and in the main tower. So at our entrances right now, everybody's getting screening, and I'm sure that's the same with all of our sister hospitals in the area, to do everything that we can to ensure the safety of all of our visitors and patients and physicians and employees. So everybody gets screened, everybody gets temperature checked, and we're really adhering to 1 visitor per patient. And that's in our current modified level 2. We are really focusing on social distancing. We've arranged all of our waiting areas at 6 feet apart. So really adhering to the social distancing, hand hygiene. Everyone has to hand hygiene when they're come into the building, as well as all of our employees at the employee entrance and our physicians. Employees and physicians are also being temperature checked as well. And as I mentioned, we started doing elective cases on Monday. So allowing 1 visitor per patient. As far as our Clear Lake statistics, we have had a total of 428 PUIs, which is patients under investigation who would be getting testing. We've had 394 negative tests, 34 positive tests, and we have had 1 mortality at Clear Lake. Our lab testing capability, we have 2 machines. They're both Abbott machines, an Abbott M2000, which is a high capacity machine. And then we have a Abbott ID Now, which is a rapid testing machine. And so far on our M2000, we've done about 3,450 tests, 333 positives, which is about a 10% positive ratio. And then we just started our rapid testing on April 20th, and we've done 157 tests, 4 of which have been positive. So that's just kind of an overview of Clear Lake, and I'll be happy to answer any questions later on. So thank you, Bob.
Todd, thanks a lot. Okay, Stephen.
Great. Good afternoon, everybody. My name is Stephen Jones, and I first want to start off.
Lost his sound. We lost Stephen's sound. There you go.
Oh, okay, I got it. So again, everyone, I'm Stephen Jones, the CEO here at UTMB Clear Lake campus, and I want to start by thanking the community. We could not have gotten through this as a hospital and as first responders without the sacrifices of the community. We know that these have been very difficult times for everybody, and so UTMB is proud to be here for the community and doing the work on the front line with so many great people. So I want to thank the community. And so I thought I would just phrase my comments in what was a day like? What did a day look like from a big picture standpoint, and how it was different than days before? And so the day would start by going down and getting my temperature checked, having questions asked of me, a screening process, and then getting a sticker that said I had been screened, that my temperature was where it needed to be, and it was okay for me and safe for me to come to work. We would then start our morning with a 9 o'clock command center led by Dr. Ben Raymer, our president of UTMB. It included our top executives like Dr. Sharma, who you'll hear from shortly. And we would talk about what is going on in each of the UTMB hospitals. We would talk about our PPE and how we're doing with the equipment that we need to keep patients and employees safe. We would talk about our patients. We would talk about the specific numbers that Dr. Sharma will talk about later. And we would go in a very detailed manner through the day and really manage the day very closely. Then we'd spend our morning going to our units. We would spend our morning going to our COVID-19 cohort unit where we would have our COVID-19 patients, and we would talk to the staff there, and we would make sure they had the tools and resources they needed to be safe, because they are in direct contact with patients that we know are sick COVID-19 patients. And so we wanted to make sure they had all of the tools and resources to treat patients safely and keep themselves safe. And so we would make sure of that. We would talk to them and we would get the things that they needed to make sure they were safe. And we would do that in our cohorted unit. And we would do that then in our emergency department, who were the front lines, right? Those were the very first folks to see COVID patients when they would just walk into the hospital, whether that was in the tents that were created out front or in the hospital. We would then go to other units that you might not always think about. We would go to our pediatric unit. We'd go to our labor and delivery unit. These other units that you may not hear or talk a lot about, but these units that also potentially had COVID-19 patients. And so we would make sure the pediatric nurses had the tools they needed. We made sure the labor and delivery nurses had the tools they needed to be safe and to deliver babies in a safe manner in this new environment that we are all living in. And then every day at 12:30, we would have a physician call that we still have today. And we did this 7 days a week, including Saturday and Sunday, where we talked to the medical staff and they could call in. And we'd start with an administrative update and we'd share with them some of the new policy and procedures that were evolving because things constantly changed. We would then do an infection prevention update. We have world leaders at UTMB in infection prevention. And so we would have them talk with our medical staff directly and let the medical staff ask us questions. We'd spend the afternoon doing the same rounding that I described earlier in all these units. And then we would sort of finish up the day at 4:30 with another command center call led by Dr. Sharma and others to go through what did we accomplish for the day and what did we need to work on that evening to make sure we were ready for the next day. And so that is the environment that we've lived under for nearly 6 weeks now. And now we're evolving to say we're going to have COVID-19 patients moving forward. How do we manage those patients safely and open back up for business in a safe manner? And so that just gives you a little sense of what the day and environment has been like inside our hospital for the last 6 weeks. So thank you.
Stephen, thanks a lot. Dan?
Yeah, good afternoon. I'm Dan Newman. I'm the CEO of Houston Methodist Clear Lake Hospital. And similar to what Todd and Stephen said, it's certainly a unique time that it's important to remember the work that our teams are doing, and for our doctors and for our nurses and everybody taking care of these patients. Not only is that challenging at home, it's also challenging, or at work, it's also challenging at home. Being fearful of what I might be bringing from the hospital back to my family is a real concern. So keep those people in your thoughts and prayers. This is not over by a long shot, although things are certainly improving. Much as what Todd said, similar to Houston Methodist, we began a screening process of not only our employees, but also any visitor or patient back in mid-March. So we were intending to be ahead of any concern. And we also made some tough decisions around that time to start scaling back on elective procedures. For quite some time, elective surgeries, elective imaging procedures, we weren't doing that. And that creates a weird dynamic inside the hospital of where you have many fewer patients, fewer employees. We had a number of people that began working from home and continue to do so to help with social distancing. Only now are we resuming some normal operations, but it's in a much different way than it had been in the past. So things like our typical disasters that we're familiar with, a hurricane, for example, have a clear beginning and end. And so, you can see it on the tracker when it's coming in, what the projected path is, and then there's a recovery after that. But clearly this is something very different. And so even though we're resuming operations, it's not quite normal. And I'm not sure when we'll be back to normal, but ensuring that we're doing things in a way to keep our patients and our employees safe, that's the most important thing that we're doing now.
Great, Dan. Thanks. Kelly?
Good afternoon. My name is Kelly Ochoa. I'm the Vice President of Operations for Memorial Hermann Southeast and Pearland campuses. And much like you have heard from all the others, Memorial Hermann also had plans in place. And, it's incredible the amount of work that is required to pull off the surge plan. And then to begin unwinding that plan to return to normal operations just takes a whole host of work behind the scenes. But much like you've heard from everyone else, we had strategic priorities in place. And first and foremost, we were concerned about the safety of our employees and our physicians and team in general, and certainly the community and the public to whom we would be providing care. We had a multi-level surge plan. We did some of the same kinds of things you've heard already, from cohorting units, front door screening. We made a tough decision to limit visitors, again, in the name of safety. But in all of that difficulty, I'm also very proud of the innovation and some of the things that are emerging as a result of this unprecedented time. So just to share a little bit about one strategy that we've used that's just been hugely popular has been we've been employing, we bought a bunch of iPads, lots and lots of iPads, and we deployed them out on the units in the hospital and created an opportunity through Zoom conferencing where patients could visit with their families. And so we created a schedule, and that's not only helped promote healing, just to put some of the family members, while they weren't able to have visitors in the hospital, back in touch with their family members. And of course, we're working toward revived visitation, and we continue to monitor the situation and revise that. But that's been something that, just the innovation that's come forth during this time has been impressive. The other thing I would like to note is that we have really felt such incredible support from the community. We have had folks come and do parking lot greetings and cheering sections, putting up signage and honking and clapping and cheering for the staff as they come and go. That's been incredibly well received by the staff and our physicians. We've had food donations and PPE donations. I mean, I cannot express enough how the outpouring of support from the community has really helped bridge the what I'm going to call a gap related to just fear and stress by our team. So we're very, very thankful for that. And we too are looking, now to return to normal operations. So we're back to elective procedures, meaning, diagnostic radiology procedures, and we're also beginning our surgery schedule, bringing that back online. And we're doing all of that while continuing to monitor as Governor Abbott slowly plans to open Texas back up. We too are opening up just cautiously and carefully, making sure that we're keeping an eye on what's happening in the community and ensuring that patients, visitors, staff, and physicians coming and going from our facility will be able to be kept safe as we monitor the situation in the community and the state. So very thankful overall to be a part of the community. Happy to be seeing some, what I'm tenderly going to call normalcy return. And just looking forward to continuing to work with our counterparts in this community to care for those that we continually collectively serve.
Kelly, thank you for those comments. We're going to talk a little bit about COVID-19 and some regional statistics, and Dr. Sharma is going to share that with us. But before he starts speaking, let me say a few words about Dr. Sharma. He is the Chief Medical and Clinical Innovation Officer for UTMB. He is currently leading UTMB's health response to the COVID-19 pandemic, and he's also working with the Galveston National Lab on COVID-19 testing, COVID-19 vaccine research, and antibody testing. So Dr. Sharma, will you take 5 to 7 minutes and give us a few statistics?
Sure. Thank you, Bob, for that kind introduction. So my specialty is pulmonary critical care medicine. So this virus is almost near and dear to us and our provider who are doing work and taking care of patient in our ICU setting. So just from statistics standpoint, so everybody can put things into perspective. So if you look at nationally, we have done about 6 million tests and 1 million are positive. So that gives you a test positive rate of 16, 17% nationally. When you come to Texas, we have done about 340,000 tests and 27,000 are positive. That gives you a prevalence of about 12% in Texas. When you come to in a local area in terms of Harris County, Galveston County, the test positive rates in this county is about 9%, and Galveston County is about 3.5%. So regionally, we have fared very well compared to what is going on in other areas because most of the high numbers are coming from states like New York and Massachusetts and Connecticut as well as New Jersey. So Texas with social distancing and early lockdown, I think has really fared very well. In terms of current prevalence of this disease in our area, a number of cases have continued to decline throughout Harris County as well as Galveston County. Our number of admission and ICU utilization is also have down. There is plenty of ventilator capacity and ICU capacity and med-surg capacity across the Greater Texas Medical Center, if you want to think about that way. So UTMB currently has performed over 27,000 tests. We started testing March 13th, and we got the virus early on in the first week of February from CDC. So we developed our own test with our well-renowned Galveston National Lab here, and we brought that test into the clinical setting. I remember it took almost 12 hours to do one test at that time when we first started that test. Now we actually do 2,000 tests a day. That is our current capacity. We have ramped up our testing capability tremendously. We are helping not only Galveston, Greater Houston Community Texas Medical Center. We are getting samples from throughout Texas. We actually have done more testing outside of our region than in our region. So we are open. We are very fortunate to have those capability to provide to our community locally. We have reached out to our nursing home because that's where the largest outbreaks are regionally. We have also worked out within the correctional care facility to help out correctional care facility to make sure that we do not have a large outbreak there and to test them. Currently, we have taken care of in all our health system, Clear Lake, as well as League City, UTMB here in Angleton. We have 98 patients that were admitted with COVID positive. There were 12 deaths. Most of these deaths are in nursing home and advanced age individuals. 73 of them were discharged home. So the mortality rates is fairly low compared to what is predicted or projected from other regions nationally. The challenge here is the mortality rate goes up when you put somebody on a ventilator or respirator. If they come early and we can address their needs, I think that's the best way to protect them. Another thing, we have also tested 3,000 of our own employees. So in our own employee, the prevalence is similar what we are seeing in the community. They're all asymptomatic that we tested. Out of 2,200 who were asymptomatic, the test positive rate is 1.6%. So that is typical what we are seeing in the community. So I think we are fortunate in our area that we have really helped reduce the large surge of the cases here with everything that we have done. Another thing for us is we are also adding an antibody test. Starting tomorrow, we will be offering antibody tests. So we looked at all different tests and we picked the test which has given us better sensitivity and specificity. One of the challenge there is there are a lot of antibody tests that are out there. We are not sure whether they are measuring antibody to common cold or really to this coronavirus 19. So given our capability within Galveston National Lab, we partner with them and we make sure that we pick up the right antibody test to help our patients and our employees and local community. So I think for us, as far as the surge capacity, as far as taking care of patients safely, we have not seen any community transmission, any healthcare worker transmission in large scale, because we have taken care of large number of patients in our Freewell side, if I have to say that. And we currently are taking care of almost 130 prisoners who actually have COVID positive cases, and there are about 70 of them in the hospital setting. We have tested everybody, all of our employees, to make sure they are safe and we are providing safe care. As Stephen mentioned, everybody goes through proper PPE. We have adequate supplies to take care of them. We have adequate staffing to do the work. So we are working with our national lab in terms of vaccine development, and we participated in this remdesivir trial, as you heard in local news. Seems like that's probably the most promising drug that we should be offering it in the near future once the FDA approved it. That's all I have to say, and happy to take any question, Bob.
Thank you, Dr. Sharma. What we'll do now is we're going to go to some specific questions that we're going to ask each administrator. And once the administrator answers that question, if somebody else on the panel wants to add to it, please feel free to do so. Todd, we're going to start with you. Is it safe to go to the hospital?
Yeah, I mean, absolutely. I think I can speak on behalf of all of us on the phone. All of our systems have gone through extreme measures to protect the safety and well-being of all of our patients, our employees, our physicians. We've all put in measures from the screening process we talked about. Everybody who enters our building is getting screened, is getting temperature checked. We've put in very strict social distancing requirements now that we're allowing visitors to come in. It's been super, super important how we've changed our waiting rooms, how we navigate through our hospital. And then when you look at the testing, I mean, not only all of our symptomatic patients or our employees, anybody who has symptoms are being tested. And then as people come in the building, any symptomatic patients are being tested. So I would like to reassure everyone, especially everyone in the public, that all of our hospitals have gone to extreme measures to protect the safety of everyone who comes in our buildings.
Anybody else want to talk? Okay. All right, let's see. Stephen, you're up next. How is the resource loading? You know, doctors, nurses, etc.
As Dr. Sharma mentioned, we've been fortunate here with the numbers that we've seen has not been as great as other parts of the country. But saying that, all of the health systems, including UTMB, went through a process of great detail looking at the number of doctors, the number of nurses, the number of respiratory techs. We don't talk a lot about respiratory therapy, supply chain personnel, environmental services, all sorts of key frontline folks. We do have enough. I want to assure the community, similar to what Todd said, we've got enough infrastructure, people, supplies to effectively continue to take care of COVID-19 patients and open back up for business. So all of the hospitals are putting plans in place to do both very, very safely. Continue to take care of COVID-19 patients and take care of elective business moving forward, emergency room business. Our outpatient clinics safely. And so we're doing that by very detailed plans. Everybody has backup plans. So you'll have backup ER plans, you'll have backup dialysis plans and backup critical care plans and backup intubation plans. So every health system has really done a nice job of studying their resources. All the health systems, UTMB included, have also done a really good job of detailing out how can you be flexible with nursing staff. If you have a hospital that has a surge, how do you then transfer nurses over that work in one location to another location? How do you make sure you do that safely, that they have the right orientation to that other hospital? So there's been just great work done by all of the healthcare systems to make sure that level of detail and management is done to safely take care of COVID-19 and open for business. So I'd throw it over to Dr. Sharma for any additional comments about resources for the health systems.
I think we were fortunate enough, as Steve said, we learned quickly from New York. So we were almost delayed by 3 to 4 weeks. So everybody in the region was able to collaborate. We are all partner of Texas Medical Center. So we have a daily call at 6 a.m. across TMC. So everybody shares their best practices. Everybody shared what they have if somebody needs. So for us, we were actually helping with testing capability for Texas Medical Centers. It took a while for everybody to develop their test and ramp up their capabilities. So we helped out everybody who we can. And for even nursing home, we are actually supplying PPEs to nursing home because they were not able to get PPE to take care of their patients. And in the beginning, they were not accepting any patients who were COVID positive. So once they get the PPE, we train them to make sure they are safe. So there is not going to be a risk of spread of the disease in the nursing homes. So they are all happy, and we want to work collaboratively in the region.
Thank you, Dr. Sharma. Let me remind everybody on the call, if you've got questions, you can send those in, and Jimmy will, he will kind of stack them for us, and we can try to answer those questions at the end. Dan, it's up to you now. How can the local community help the medical community?
Yeah, I certainly will answer that. Just to tag on to what was said about, is it safe to come back to hospitals? You're familiar with the saying, prepare for the worst and hope for the best. And certainly throughout this process, I think we all have been preparing for the worst. Unfortunately, the worst, which we believe to be behind us, is now in the rearview mirror. But as part of that process, we've learned a lot that we might not have known quite as readily before. So with regard to a surge plan, having staff that can support the hospital in different roles than what might be their normal job, how you can accommodate a surge of patients in different areas of the hospital that may be unconventional, how many anesthesia machines could be converted to a ventilator should the need arise. That actually prepares us better in the future. So should there be another wave, we certainly will be ready for that in ways that we might not have ever imagined before. So we just want to echo the comments that yes, it is indeed safe to be in the hospital, and certainly caring for both the COVID patients and patients that are here for elective procedures. We're safe. And that really kind of speaks to this question, Bob, that you asked about what can the community do to support the medical community. Take care of yourself. There's been some articles written, particularly in New York, about people delaying their return to their doctor and receiving health care. Health isn't something that is something you just do when things are, the weather's nice outside. You have to take care of yourself all the time. And to the extent that that care is delayed can result in, worse outcomes than if you seek care now. At Methodist, we provided rather quickly a shift from in-person visits to video visits. And that's allowed for some continuity of care for the patient. But sometimes you need to come into to see your doctor, you need to come into the hospital. And again, both safe to do so, and it's important that you take care of yourself. That's probably the biggest thing you can do to help the medical community.
Thank you. Any other comments? Okay, Kelly, what is the impact on the ER usage, and how will the corner ER and urgent care centers fare in this environment?
So I'll just, I'll answer that in a minute, but I do just want to echo what Dan said and earlier, what Stephen was saying. We are it's a perfectly safe environment for patients to come back in. And we are continually monitoring the current situation, and we'll make revisions as need be in order to make sure that we're providing safe care to the community. What Stephen said earlier that struck me was with other natural disasters, there's a clear beginning and a clear end. And in this COVID-19 environment, that has not necessarily been the case. We've learned a lot, and we continue to learn, as we've heard from Dr. Sharma. And I'm continually in awe of what healthcare providers, both locally, nationally, and worldwide, are doing in order to address the pandemic. So I say that to say that, you know, there's things that we're learning and there's things that we know and we don't know. So what we do know about ER visits in general, for the ERs associated with the hospitals, we've seen a decline in the number of visits. And as Dan was indicating, people still need health care, but I think there's been, you know, lots of fear about either coming here, and you know, I'm sure that the freestanding ERs have also experienced during this time a drop in patient visits. What I know about the urgent cares, particularly the Memorial Hermann urgent cares, we've seen an incredible expansion of telehealth, again, was already previously mentioned. But I expect that will continue to expand over time as we continue to navigate this environment. As we incorporate more televisits or telehealth visits long term, I think that the expansion of that care delivery model will continue to thrive and you know, exist. I know that some of the freestanding ERs have been under pressure from the payers. And so I think on that front, that remains to be seen. And I think that like many businesses, if you will, you know, I think that we'll see over time what the impact of the pandemic is on some of those, you know, what we're referring to as corner ERs.
Thank you, Kelly. Any other comments? Okay, Todd, you're up. How are the protocols going to change in the future?
So I think, Bob, when I look at what we've all gone through, and when you think about what protocols are going to change, I think we might be looking at a situation where this may be the new norm for a while. When you look at everybody being a whole lot more cognizant of social distancing, when you look at the new norm of people maybe not flowing right back into super large gatherings again. You know, our screening processes, I don't know how long they'll last for, but it's probably going to be a little longer than we anticipated, especially as we get closer to a flu season. So, you know, I think it may be more of a combination of a new norm and everybody being a whole lot more alert of hand hygiene, social distancing, and the things that we are doing to not only protect ourselves, but to protect those around us.
Good deal. Jimmy, are we getting questions coming in? Okay, good. Now the next three questions we've kind of beat around a little bit, but I think we need to focus on them even a little bit more. Mark Geyer, the JSC Center Director. Stephen, this is your question, okay? Mark Geyer, the JSC Center Director, recently mentioned that as part of the phased return to work process that JSC will go through over a several week period, there will be some indicators of hospital capacity to ensure that favorable trends are existing in our region's medical facilities should things take a turn for the worse as we begin returning to work. It was mentioned that the Texas Medical Center has some metrics they are monitoring. Does the metrics include Bay Area, regional area, medical capacity?
The answer is yes to that. I'll make a comment or two, and then I'll kick it to Dr. Sharma, since he's very much involved in those Texas Medical Center calls that he mentioned earlier, is that we're certainly monitoring what is happening in the community. We're going to continue to monitor the COVID-19 volumes. We're going to monitor all volumes as we get into flu season, that was said earlier. So nobody thinks this is done. Nobody thinks that. we have to learn to operate our hospitals safely and effectively, which we are, with COVID-19 initiatives at the same time. And so we're going to monitor every day what we're doing. And if we need to make modifications to what that looks like, all of the health systems, including UTMB, are going to do that. So even though things reopen, we as leaders in the healthcare field, we talk about COVID-19 all day long, in addition to talking about opening up for business all day long, and in addition to talking about how it's safe to come to our hospitals all day long. And so we'll continue to monitor and assure that we've got capacity to safely do both. So with that, Dr. Sharma, I'll kick it over to you.
Sure, Stephen. As you all know, that the governor basically asked every hospital to have 15% of their bed available to take care of COVID-19 as we start bringing our normal operations. So when we look at TMC data, it does include, all hospitals within the Texas Medical Center, including Bay Area Regional Hospital. So just over the estimates still currently are over 40 to 50% of bed capacity is open across Texas Medical Center if you look at the data today. So we have plenty of ICU beds, we have plenty of ventilators, we have plenty of med surg capacity across our health system in the Texas Medical Center and Bay Area Regional. As we bring back our normal operations, we're going to continue to have our designated cohorting unit in terms of where we are going to be putting these patients if we have a surge as we relax this lockdown over the next 2 weeks and 4 weeks. As the incubation period of this disease is about 2 weeks, so we will start seeing if there's a true surge by the third week of May. So that will give us a good idea where things stand as we relax this curfew, if you may call it. And so I think every hospital within the Texas Medical Center is capable and willing and safely be able to provide care for these patients. We have plenty of ventilators across the state of Texas. We are glad that we don't have to use it. It turns out we need more of high flow oxygen than ventilators in these patients to help them. So that's what we are investing in. That's what we want to make sure everybody has that to safely take care of these patients. Back to you, Bob.
Thank you, Dr. Sharma. I'm not going to ask this one question because we've talked about COVID testing quite a bit. So we got one question left. And Jimmy, if you don't mind, go through some of those questions. And if we haven't answered the questions that you've received, I'm going to get you to read some of those questions, and then we'll let anybody answer them as they want to. But let me pass this question off to Dan. He's next. So. And we've talked about this a little bit already, but it's never going to hurt to talk more about it. And that is, how are healthcare workers being kept safe?
I think we've all talked about the screening when you come in. I'll give you an example that happened just this week here. One of our employees that works in administration was asked the typical screening questions when she came in of any symptoms. And she said, my throat's a little bit sore. Allergies happens every year. Well, that's one of the symptoms that we screen for. And so the answer was, is she goes home, she gets a video visit, gets a COVID test, she's negative, and then she comes back to work just today. So things like that of keeping anybody that might even be symptomatic, much less positive, home is important. Other things that we're doing, surveillance testing, which is a prospective test of our frontline employees to see, there are people that that are asymptomatic but are still testing positive. It's important to identify those employees so that they're not working and potentially contaminating anyone else. And so that testing has been occurring for our employees. This week we'll be testing physicians. And so those are some of the proactive things that we're doing. But the thing that you hear a lot of is appropriate use of personal protective equipment and making sure that we have adequate supplies. Early on in this process, our system, much as I'm assuming UTMB and HCA and Memorial Hermann did, is we talked as a system about PPE and supplies so that we had standards and we were consistent. We used the CDC guidelines for what is appropriate PPE, what is necessary. It's easy to fall into a trap of what people may want, but being mindful of quantities and when the supplies are going to be coming in. Fortunately, we have supplies that are not only adequate, but we have plenty. And another comment I would make is that all of our systems have been part of a call on a regular basis, I think a daily call, and even being able to share PPE across hospital systems. It's really a great thing to be a part of, not only from Houston Methodist perspective, the Houston community, but this community where there is a willingness to share and support one another if things got really tight. But those are the things, I think: surveillance testing, screening of employees, being very proactive about getting people out of the workplace, working from home, and then the PPE piece.
Yeah, Bob, I'd like to add to Dan's comments, and just the one thing on the PPE component to ensure that all of our employees are protected. And I know Dan and the rest of the folks are doing the amount of training that we've done to our staff to ensure the appropriate use of it. And because it's been a little bit different when you're taking care of 5 or 6, 7 infected patients, how you don and doff the right way. And it's really, really important that you use your PPE appropriately. And it's not just an everyday deal that we're taking care of this amount of patients who are this high risk of infection. So we've all of our hospitals have done a lot of training to keep our staff safe, but also keep patients and physicians safe as well.
I tell you what, it's been a tough education, but a couple of you already said we're going to be better prepared next go around. There's no doubt about that.
Absolutely.
So, Jimmy, do you have a couple of questions that you want to ask?
Yeah, so we've had some questions about how hospitals are keeping their staff safe. What recommendations do y'all have for businesses that are bringing employees back to work? What kind of procedures can you recommend to have in place to make sure that returning to work is safe for businesses and staff?
So I can address that. So I think the best thing is for us to make sure we have a screening questionnaire for all the employees. So talk about, did you have any fever? You know, if you can get a device for temperature check as screening, I think that would be great. Ask about cough, shortness of breath, difficulty breathing, the symptoms that are related to COVID, and then ask a question specifically that, is there anyone who tested COVID positive in the last month or 2 months since the employee was furloughed or the business was closed, to make sure the employee was not in contact with anybody who is COVID positive. If the screening questionnaires are negative, then I think it is safe for the employee to work as far as we are doing social distancing and we are masking. Because there is still an asymptomatic carrier state that people can be asymptomatic and still can have coronavirus. And that we are seeing in terms of the rates is 1 to 2%. It is very low compared to what we are seeing at other areas. So if you really want to get tested, your employee, you can get them tested, but I think it is not mandatory to test all employees. Screening questionnaire would suffice, or any exposure to a COVID case would be suffice for them to return to work. But I'm sure most, as us, all the other institutions have tremendous capability to test if that is something you need.
So I would ask the question, can I get one of our administrators to maybe help us put together a screening test that we can send out to all of our members? So I'll put all of y'all on the spot.
Not a problem.
Yeah, what I would recommend is if you look at Governor Abbott's executive order dated April 27th, there are specific paragraphs in that executive order that talk about this is what employers should do. And Dr. Sharma and others have all mentioned those items. And they talk about employers in general. They talk about employees. They talk about types of businesses, whether it's restaurants, retail, et cetera. So I think the hospitals can help with that. But I would tell you very directly, if we worked with BAHEP and looked at that executive order, many of the things that Dr. Sharma just mentioned are outlined very specifically in that April 27th order.
Got it. Good stuff. Okay, thank you.
There are specific questions here for me, so I can address those if you want.
All right, thank you, Dr. Sharma.
So they ask about medication that look promising. Yes, there is a medication called the antiviral drug called remdesivir. The clinical trial shows promising result, as you have seen in all the news channel, and Dr. Fauci actually came and said, but it is not published in a peer-reviewed journal. and FDA has not given approval for use. So current availability of this drug is still participation in clinical trials. We actually enrolled about 10 patients in that clinical trial at UTMB, and we are participating in that clinical trial if the patient meets criteria for that particular drug. The second question is, I feel like my husband and I had COVID in February. I had somewhat mild case. He almost died. When will antibody tests be readily available? So we are offering it starting tomorrow. And your primary care doc can order an antibody test. This is an IgG. So just to explain, when you have an infection, your body builds an immune response. The first one you build is IgM. As it gets a little bit further away, 2 to 4 weeks, you will build IgG. I want to caution everybody, just because you have an antibody, that does not mean you will be protected. All it means is you have an infection with this virus. So we still don't have enough data that whether this antibody is protective over a long period of time. Remember, we only knew about this virus 3 months. We do not have a second or third wave. That's the only way you're going to know people who are infected in wave 1, is this antibody protected in wave 2 or wave 3? So more to come, but you can actually go to any of our place and have your primary care doc order your antibody test, and we can do that. And the antibody test can run within 4 hours.
Great. All right.
Kind of a follow-up to what we've been discussing. We've talked a lot about physical health. We have a question about mental health. Are there ways that we can go about helping to protect mental health of employees as they're going through kind of this emotional tightrope of working COVID-19 and returning to work?
Jimmy, so I'll go ahead and address that and then invite the rest of the panel to weigh in as they desire. Memorial Hermann has, of course, an employee assistance program, and the employees, if they needed to tap that resource, would be able to be offered some free visits, a series of free visits with a licensed counselor. That's one thing that is a benefit, a service available to our employees. We've done some other things as well. We've put some limits into our scheduling system so that our staff are not just working back to back to back to back shifts. We have some rules set up in the scheduling system, if you will, and if someone wanted to do an extended number of shifts, then they would have to get special approval to do that. And then the third thing we've done is during the height of this pandemic, we've established leadership rounding teams, and we've rounded 7 days a week in the hospital. Again, I think you heard from some of the other panelists that it's been a real hands-on time for leaders at every level in hospital systems in our community. And so it's been no different for us, but we've had chaplains on site rounding on folks. We've done lots of things. There's been lots of services brought to the team from our chaplains, up to and including small things like on the unit prayers and blessing of the hands and things like that. But then we've also got more structured programs where they have mental health support available through our employee assistance program. I think somebody said it earlier, we've been very fortunate in Texas, and certainly in this area of Texas, in our local community, not to see some of the numbers that some of our other states have experienced. And our load has been very manageable. And I'm very, of course, thankful for that. But we do have those resources available in an attempt to take care of the whole employee, to answer the question.
When you talk about the spread, I can go back and remember when they canceled the Houston Livestock Show and Rodeo. And I said to myself at that time, that is so ridiculous. And that was probably the smartest move that we ever made, was canceling the Houston Livestock Show and Rodeo. And again, I can kick myself for laughing about it, but it was certainly no joke. It's the best thing we ever did. So, Jimmy, do you have any other questions?
I do. When it comes to elective or non-essential procedures and surgeries, what is the timeline for starting to perform those again, and how will the public be able to schedule those going forward?
So I'll take a stab at that. We are following Governor Abbott's order where we're resuming elective surgeries beginning Friday. So we're scheduling those now, and that process is no different than it was before, with one exception. We are testing every patient that the surgeon or patient want tested for COVID prior to the surgery. But other than that, the process for getting in to see your doctor, getting into the hospital is the same as it had been before. Again, we will screen the patients when they come in, same with employees, but that process now is resumed effectively normal operations now.
All right. Todd, you look like you got something to say. No?
Say it again.
I said it looked like you were about to say something.
I was just going to add that we actually started doing the elective procedures on Monday, and the only thing that's changed different from us is that we are testing all patients who are undergoing a high-risk procedure. And we define high-risk procedure as intubations, which is general anesthesia. So if anything that's aerosolizing in the room, they're going to be tested. So all intubations, all general anesthesia will get tested, and that requires 48 hours. So the only thing that's changing a little different for us is that patients will have to go through pre-admit testing 48 hours in advance to give us plenty of time to get the results.
Okay.
The only thing I would add that the guys have said is that we all know people who put things off, right? They were required to put things off. And so I certainly would tie this question and comment with, is it safe to be in hospitals and clinics? And then I would encourage folks to reach out to your doctor. We don't want people sitting at home not seeking medical care because they're afraid of the hospital or their clinic. And so every health system has done an amazing job keeping the hospitals and the outpatient clinics safe, and it is safe to go to see the doctor. And so I just want to encourage all of the folks who are participating today that reach out to your doctor, talk to him or her. I mean, if you have needs, everybody is now open for business. It's appropriate for us to meet those needs. It's safe for us to meet those needs. So please reach out to your doctor if you need to. That's the message that I would deliver. If you need something, reach out to your physician.
Thanks, Stephen.
All right,
Jimmy?
we have about 5 minutes left, so I didn't know if you wanted to do closing remarks or remind people about our the rest of the webinars we have in this series coming up.
Sure. So would anybody like to make any closing remarks? If not, I was going to make a couple of announcements. I guess that means no. So before I make those announcements, I cannot thank our panelists enough for participating today. You've got busy schedules, and I understand that, but it means so much to this community that you were able to share your knowledge today with all. So I do want to mention that this is going to be kind of like a series of membership meetings. Next Tuesday, we're going to have our education. Leaders in education are going to be having the same type of Zoom event that we're having today. There's a lot of stuff going on in education, a lot of unknowns going on in education. So we're looking forward to doing that. And the next Thursday, Center Director Mark Geyer is going to address what's going on in the aerospace and all the great exciting things that are happening right now. And then we're going to follow that with a small business meeting the following Tuesday. So just kind of look at your emails and we'll get you the detailed information. And again, I want to thank everybody for being on the call today. And again, I want to thank our panelists so much. So that's it. Thank you.
Thanks, Bob.
Thanks so much. Stay safe, everyone.
Thanks.
Thank you all
Take
very
care,
much.
everyone.
Thank you.